So good afternoon, everyone. I wanted to welcome you to our webinar series on postnatal care in a pandemic. The focus of our series this month is early well baby follow-up, and this is part one of a two-part series. So we have an amazing lineup of panelists today, and then next week as well, we have part two. So I wanted to just review the objectives that we promoted for the webinar. We want to talk about the priority concerns related to early postnatal follow-up that was identified through the CMNRP postnatal care rapid response data collection that occurred last summer. We want to develop awareness about the available well baby follow-up in the region and to describe features of innovative postnatal well baby follow-up initiatives that are occurring in the region, and then to talk about tips and tricks for providing well baby follow-up during these times. So the Champlain Maternal Newborn Regional Program, or CMNRP, is a regional integrated network. And so the mandate of CMNRP is to provide leadership and support and coordination for the planning and delivery of maternal newborn services in Eastern and Southeastern Ontario. And we have a number of partners, including hospitals, public health, community health centers, academic institutions, community agencies, and very importantly, families are our partners. And so you can think about anyone in the world of maternal newborn care, pregnancy, birth, postnatal, lactation support, anybody who are supporting families during this important time. This is who we are as CMNRP. So there's a very small team in the Secretariat, but many, many partners and many, many stakeholders who are working on important initiatives. And so what we're talking about today in terms of postnatal care in a pandemic is a perfect example of how we as a network come together to identify ways that we can provide the very best care to families in our region and beyond. And so very early in the pandemic, we were starting to hear that there was concerns about families being able to access timely postnatal follow-up. And we heard that from healthcare providers, and we also heard that from families. And so we were asked to form a task force to really look into this issue. And the question was, what is the need that is not being met? So we formed a task force of diverse members, and you can see them listed here. The task force was co-led by Dr. Daisy Morse, who's a family physician and head of the Division of Maternal and Newborn Care at the Ottawa Hospital, as well as myself. So we had a really engaged and committed group of membership who worked tirelessly through the summer and early fall to really better understand this issue. And so some of the members actually were supported with their organization, and we had a number of members who were volunteering on their own time. And we also had one family advisor, Amanda DeGrasse. So we just really appreciated everybody's time and contributions to this important work. So the task force identified 3 strategies to gather information related to this issue. We developed a healthcare provider survey that was based on the 10 postnatal standards from the Provincial Council for Maternal and Child Health. Those were the postnatal standards for families. And we were looking to also, in addition to that, we identified 5 indicators from the Breastfeeding Committee of Canada. So there were a total of 15 indicators that were included in that survey. At the same time, we were looking for examples of innovations. We knew that people were getting really creative in terms of identifying strategies to deliver care in a different way. I mean, that's what the pandemic has forced us to do. And so a key part of the knowledge translation piece is really sharing those innovations. And that's what we're profiling through these webinar series. So you'll hear from a couple amazing providers today in terms of what they were doing. The third component was a parent survey. So we've drafted a number of questions to better understand the family experience during this time. And we've not collected data on that at this time. So here's just a screenshot of the data collection tool. On the left-hand side, there's the the indicators listed, and then there's a grayed out box about pre-COVID implementation, what was happening at their organizations, and then the current situation within the pandemic. What did this look like? You know, what services were suspended, what needed to be modified, and what was fully operational? And then what were the limitations and barriers that people were experiencing? So in total, we received 42 data collection forms, and that's a pretty impressive number because each data collection form represents multiple individuals from an organization. And again, this was being collected through the summertime last year. So 16 were from community-based organizations, 10 were from hospital partners, 8 were from primary care, so that would include nurse practitioner-leds and family physicians, and then 5 public health units, and then 3 midwifery groups. So when we looked at the last question about priority needs and concerns, and I put it into an application called a Wordle, it basically takes the words that most frequently showed up. And you can see here, it was about support, it was about access, it was about care and health. And so I don't think that's surprising to anyone today. We looked at how people ranked their priority concerns, and overwhelmingly breastfeeding became the first top concern that everybody had, followed very closely by mental health. And then the third priority concern is newborn follow-up, and that's what we're going to be speaking about today. So I have a few quotes from the data collection form that I thought would be helpful to share with you. It kind of broke down into 2 main themes. One was the timing of the follow-up appointments. And so one family health team respondent said the follow-up appointments were generally booked 1 week after hospital discharge. However, the current request is that healthy, thriving babies be seen in 24 to 72 hours for regular follow-up. And this is not always a manageable time frame. Urgent appointments are accommodated. So a primary care respondent said that we have continued to see all newborns and mothers for a follow-up 2 weeks after birth, unless hospitals or midwives recommend otherwise. We have not ceased any well baby care during COVID-19, and we are still performing immunizations according to guidelines. And that's really important too, because some people, when the lockdown happened, they thought that family physicians were closed. And in fact, family physicians were open throughout the whole pandemic and were providing care. So that's been a really important message that we've been trying to escalate and elevate throughout the pandemic, that they are there, they're available, call for follow-up care and support. The third comment is from a public health respondent who said, anecdotally, some clients are not getting this early follow-up appointment. Many are not seeing their primary care providers until 2 weeks postpartum. So what we're seeing is that, you know, the pandemic has exacerbated any existing health system issue. So you can see here that the nimbleness of our system in terms of accommodating those early follow-ups already was challenging, and then now we're pushing it out another week or further. And that's our fourth quote here from a primary care respondent, saying that local GP OBSs and family MDs are not seeing newborns in the office after discharge until they can get in-person visit at their regular provider's office. And some people were hearing 2 to 4 weeks wait for that early postnatal follow-up. So you can kind of see that there were a lot of concerns related to when that timing of the appointment could happen. The other aspect that's important to consider is how care was delivered during these times. And so babies are not always able to be seen at their MD's offices due to scheduling, telephone access, etc. Since COVID, this has been very limited, including MDs doing appointments by telephone. And though while care couldn't quite effectively be done virtually, we've had 2 sessions on mental health counseling and support, as well as breastfeeding counseling and support. For the newborn follow-up, it has to be an in-person visit. They need to see the baby, we need to weigh the babies, we need to assess for jaundice, and that doesn't lend itself well to a telephone visit. The final comment related to a hospital respondent was because of COVID, many of our babies weren't seen by the family MD as suggested within the first 2 weeks of life. We did more 2-week follow-ups at the hospital to accommodate the parents. And so we're going to hear a little bit more about this, about, you know, what is that looking like? How how have organizations responded to these gaps and these challenges during the pandemic? So our amazing lineup of panelists, and it was so easy to reach out to our colleagues, and it was a very quick yes. We have Jody Willett, who's a registered nurse and perinatal nurse in the primary care and early years program through Centertown Community Health Center. So I'm actually going to introduce each presenter individually, and then we'll allow time for questions and answers. So Jody has over 10 years of nursing experience in supporting maternal and newborn health, including obstetrics, the neonatal intensive care nursery, as well as Healthy Babies, Healthy Children. Jody has additional training and clinical experience in the area of infant development and perinatal loss. Jody has been at Centertown Community Health Center for just over 1 year, and her role includes prenatal education, program and resource development, breastfeeding support, and direct clinical practice in the prenatal and well baby clinics. Jody is currently completing her Master's of Science in Nursing at the University of Ottawa, and she's almost done. So Jody, over to you.
Thank you, Christina, for the introduction, and thanks for having me as part of this webinar series. And so today I'm going to focus on sharing some of the initiatives that we've implemented at Centertown Community Health Center in order to continue supporting newborns and their families throughout the COVID-19 pandemic. And so as you mentioned, I do have a shared role between primary care, the medical clinics, and the early years program. And although today I'm going to focus due to the time constraints on some of our early years initiatives, I do want to highlight that at Centertown, we do have quite a few nurse practitioners and primary care providers, and we have been lucky that we could continue to provide postnatal visits for these families within 1 week of hospital discharge, and then again at the 2-week mark. And so that has been really something that our clients have really appreciated, and our team has really worked together to be able to accommodate some more of these last minute appointments, which can be a bit challenging depending on hospital discharge. And so yeah, today I want to focus on quite a few of the initiatives that we've incorporated into our early years program that are different now given the pandemic. And so one of the changes is involving our community breastfeeding support. And so prior to COVID, we offered this community breastfeeding support as a drop-in service, and this was weekly on Monday afternoons. And then so in March of last year, at the onset of the pandemic, we had to cancel our breastfeeding support for quite a few weeks since the drop-in format was no longer ideal. And we knew as a center that we wanted to continue offering this essential service to families within the community. So we started exploring ways that our center could adapt this previous approach that we had to breastfeeding support in order to meet the evolving public health recommendations. And so before making any official changes to our breastfeeding service, the lactation consultants from the other community health centers in Ottawa, as well as myself, met virtually to really discuss the changing landscape of breastfeeding support during a pandemic. And this was really a great opportunity to talk about some of the challenges that we were experiencing regarding breastfeeding support at that time, and also to identify some of the gaps in services for the families and within the community as well. And so from this discussion, Centertown changed our breastfeeding support from Monday afternoons, which was 1 to 4 p.m., to Tuesdays from 9 to 5. And so that doubled the availability of appointments that we could offer families in regards to breastfeeding support. We also transitioned away from the drop-in format to bookable appointments. And so these bookable appointments are now offered over the phone, virtually, and in person. And so another change that happened during the pandemic is that all of these appointments are actually now triaged by myself over the phone initially. And this, although it's a little bit of added work and a bit more of a case management role, this triaging has really helped to reduce the in-person flow within the center for issues that can be addressed potentially over the phone or virtually. And this also helped us in terms of managing this very limited availability of in-person appointments and making sure that these in-person spots are really reserved for the clients who need them the most. I also feel that it's important to acknowledge that the process of adapting our breastfeeding support service was really a collaboration between different teams within Centertown Community Health Center. And this collaboration allowed us to address some of the key issues that came up as we were working to transition our previous approach to a new one that would be more appropriate during the pandemic. And so examples of some of these key issues when we were brainstorming how best to approach this was determining a new location to provide breastfeeding support at the center during the pandemic. And so this was because our previous location at the center did not meet our center's new infection control protocols. The collaboration was also necessary to help us address certain logistic issues in terms of creating a process and a consent within our electronic medical records for these virtual breastfeeding consults, which we hadn't been doing pre-pandemic. And then so in addition to the breastfeeding support that we've modified and adapted during the pandemic, we also created a baby weight service. And that happens on Tuesday afternoons, and it's open to anybody in the community. So it's not catchment specific. So prior to the pandemic, this service was offered as part of our Monday afternoon breastfeeding support drop-in. And then during the pandemic, baby weights were really identified as another gap for families within the community. And parents were voicing that there were just such limited options to go get a weight done. And this is particularly important, as you mentioned, Christina, that a lot of families now, access to medical appointments was limited, and more medical appointments were being done virtually or over the phone. So families were really voicing that they needed somewhere to come in and get that weight done. And so the community weight service, again, it was a collaborative effort within our center between the early years and the primary care medical clinic. And it actually came together quite quickly. And so this service is by appointment only. It does adhere to our new COVID-19 protocols for infection control. So in terms of the cleaning practices and the use of PPE within this service. And the other collaborative approach was that we actually have an early years staff member facilitate this service. So the early years member is one of our team members, and they're available in the room to help families navigate the use of the scale. And one of the other key goals of incorporating an early years staff member into this service was so that they can actually let parents know about the other programs and services that are available and really connect them to supports that they would benefit from. And so one of the things is an example of that is our virtual play groups. And so that was really helpful to have them there, also to help families just navigate the scale. And so the staff member is behind a plexiglass, closely available to the families, but also has PPE by and has had additional training to be able to go around and support families if they need to. And it's also important, we had to think about the logistics of having an early years staff member who's not medically trained, facilitating a baby weight station. And so we do advertise this baby weight service as a non-medical appointment. And so that the weight is not interpreted by a medical team member. But if parents do have questions or concerns, then the earlier staff member is able to give them my contact information and then encourages the parents to reach out for feeding support. And then a bit more of an assessment can happen. And then one of the other early years initiatives that I really wanted to highlight today was our emergency baby cupboard. And so at Centertown, we really do support a very diverse population, and that includes a more vulnerable population, such as families living within the shelter system. And then, so this emergency baby cupboard was offered prior to COVID, and it was offered as a drop-in service. So families could come to the center and access items such as baby clothes, newborn supplies, such as diapers and wipes. And so again, during the pandemic, we really wanted to be able to continue offering this essential service to families within our community. And so we needed to start brainstorming on how we could adapt this service again to meet all of the evolving public health recommendations. And so instead of a drop-in, we started encouraging families to call the center and to inquire about this service. And then from those phone calls, the early years staff member could speak with the families. And then that was the opportunity where they can really determine with the family what their specific needs were, what items they needed help with. And then the staff member could prepare packages that were family specific and then arrange a pickup time so that the families could come to the center and pick up the items. And we weren't having this increase in traffic or inconsistent or that we knew about it ahead of time, and it was a lot more controlled. And our front reception could know about it as well. And many of the families at Centertown who are living in the shelter, they were relocated during the pandemic. And this is something that we had to keep in mind when we were reevaluating how this service was offered. And so we recognize that for many of our families, they might not be able to pick up the items easily, or that transportation could be a really big barrier for them in accessing these items. And so the early years team had arranged to have these items delivered to families. And so the deliveries were done by an early years outreach worker. And her role was modified during the pandemic as well, just to be able to meet the evolving needs of our families within the community. But we were able to offer deliveries. And again, it was a case-by-case basis, and it was really only available to families accessing services at our center. And then the last early years initiative that I wanted to share was regarding our breastfeeding supplies. And so Centertown Community Health Center is designated as a baby-friendly health center. And so we are continuously working to promote and preserve breastfeeding within the community. And so working clinically with the maternal newborn population in the primary care medical clinic, as well as offering the breastfeeding support at Centertown Community Health Center, I was really able to identify quite a few challenges for our breastfeeding families. And that included financial limitations to buy certain accessories that would really enhance their breastfeeding experience, or also issues such as transportation to go and purchase some of these items. And my manager, my supervisor in early years was actually a great advocate in terms of voicing these concerns to our leadership team and Centertown. And we actually received a one-time COVID relief grant. And some of that money was in fact allocated to the early years team to purchase some of these breastfeeding supplies. And again, the goal was really to look at what we could purchase that would be most helpful for these families, and what would really help promote and preserve breastfeeding through this challenging time of COVID. And so with that money, I'll just give you guys a few examples of some of the items that we purchased. So one of the things was these single manual breast pumps. So again, to really help out moms and be able to offer their breast milk in a bottle. So a little bit more of a flexible approach to support and to recognize that everybody was in a different situation with different struggles during the pandemic. And for some women, the ability to pump and express their breast milk and be able to give it in a bottle from time to time was very meaningful to them. And so that was one of the first items that we purchased with that money. Other examples are things such as nipple shields, milk conservation bags, nipple ointment, and vitamin D drops as well, because vitamin D drops was something, again, with the more vulnerable populations, the cost associated with it, and then, and just really, again, with promoting breastfeeding, it was something that we wanted to be able to help out families with. I also purchased microwave sterilization bags. And this was primarily to help with the cleaning of infant feeding supplies for families living within the shelter or hotels where access to appropriate cleaning spaces and supplies was a challenge. And so that's just another example of where some of that money went. And again, these supplies were provided to families, to breastfeeding families who were accessing services at Centertown Community Health Center and who really had limited financial resources to be able to purchase these items, or just real challenges in going to access them themselves. And we have got a lot of positive feedback on these items, and that they were really appreciated and valued by many families within the community. So we're really happy that that we could meet that need.
We could keep listening to all the wonderful work. You do wonderful work all the time at Centertown, but I mean, what's so impressive is how fast so many of our partners were able to flip and change the delivery. So you talked about the change to bookable appointments and a triaging process to really identify those priority appointments. You talked about all collaboration, all the different providers, interprofessional approaches to managing this situation. The baby weigh station was an innovative solution, because you're right, the baby weights were a challenge, particularly if they're having breastfeeding issues. Sometimes you just needed to wait, and then you could get on the phone and do your virtual consultation with whoever's providing that breastfeeding support. So that was a really novel idea that came up through Centertown. The emergency baby cupboard, the families that are underserviced, marginalized families, at-risk families, and just really thinking about them and making it so easy, like bringing it to them instead of them having to come seek service for you. And of course, anything that we can do to support breastfeeding and the goals that families have. So lots of examples that you provided in terms of like tangible supports, breastfeeding supplies, and responding to like real needs, as you mentioned, at the shelters and in the hotels and whatever. So thank you so much, Jody, for sharing those examples. And I'm going to look to Catherine to see if there's any comments or questions for Jody.
Yeah, so there was one comment. Someone was saying, sounds like your team has done a great job adapting your services to offer much needed care and support to families, which I agree. You did mention a lot of things that was a quick turnover. So congratulations to you and your team. And I think I did a message to you guys as well, attendees, that if you do have questions, we recommend that you put them into the question and answer box. I see none for now, but I think just something coming up. So we'll give you a few minutes just to answer your questions and put them into the Q&A, just so that it's easily seen by us. So we have one question coming up. Are the virtual play groups open to everybody?
Yeah, so that's one of the wonderful things that came out of virtual services, is that we were able to extend a little bit beyond our catchment. And so we do not limit, especially within the context of it being virtual now. A lot of our early years play groups they're mostly transitioned to virtual, and they're all open to anyone within the community and available on our website as well, if people wanted more information on what exactly our team is offering in the coming months.
That's great. Thank you. So we do have a couple of questions coming up. Do you have any prenatal courses or classes being offered?
And yeah, so at Centertown, we're continuing to run our Buns in the Oven prenatal nutrition program, which has transitioned completely virtual. And so we've worked as well in terms of the funding that we receive, and a little bit of the care packages that moms had received when they attended the center to join the virtual or to join the in-person Buns in the Oven. And so we've actually now created healthy snack packages that go out with that program as well. So again, trying to balance the transition to virtual, but with still being able to share some of those healthy snacks with the participants, so that they could still benefit in addition to listening and attending weekly virtual sessions. And then we are actually piloting right now a prenatal class. And so we just ran our first one last week, and it went quite well. And so the intent of this class was really to fill the need in terms of, again, a free prenatal class for primarily newcomers, for families who are English is not their first language. So again, looking at the lower literacy, very basic content to really help meet the need of people who would benefit from prenatal education but do not have the financial resources. And so that's something that we have been working on over the last few months, and are hoping to be able advertise for it a little bit more formally in another month or so.
Thank you so much. I think there was just one more question, and I think I'm relying on Christina to let me know when to do our next panelist. So one was some of them are using the chat box, so some of you might not be seeing all the questions being asked. How about the families? Were you able to help in terms of the supply? Is this still an ongoing project?
So is it referring in terms of the breastfeeding supplies?
Yes.
Yes, and so actually, again, I feel quite fortunate. We have quite a great team at Centertown, and they are, it's kind of a really nice level of advocacy where it starts with, you know, the frontline staff working with the patients, advocating for the needs, and then the supervisors bringing that to the decision makers. And so I was able to kind of secure a little bit more money, and again, using it very strategically. And so hoping to be a little bit creative, looking forward to continue to renew those supplies. So it's still a work in progress. We get a few different funding sources at Centertown. So again, looking to be creative, trying to apply for things and see where we can get a few extra dollars to continue to maintain those supplies. But I do have a stockpile that I have in a locked cupboard. And so again, we are hoping to maintain that, because we've had such great feedback on it, and from the clients that we support, and that's really why we're doing it. So
thank you.
Thank you so much, Jody. So I think we're going to continue on in the interest of time, but we are taking note of the questions. So I'm just going back to our list of panelists. We're actually going to pop down to our fourth panelist, who's an addition to our session today. We have Louise Gibert with us, who's a registered nurse, IBCLC, and manager of Healthy Growth and Development here in Ottawa Public Health. And she's going to be talking to you today just about some emerging information related to infant head injuries. So Louise, over to you.
Okay, thank you. Just moving my notes. Perfect. So I'm really glad to be here tonight with all of you. You probably heard about, you probably saw the news on, I think it was January 29, where Dr. Ward from CHEO was talking about how difficult it was, because in the last quarter in CHEO, they saw over 20 children with serious head injuries, and compared to 8 for the year before. The only way we can explain that huge difference is the effect of COVID on parents. And I think it's affecting all of us. Those children were not necessarily all from Ottawa, so they were from all over the region that CHEO is deserving. We're still working on this to try to find ways to make sure the parents know what to do when they get frustrated with their children. And we're talking babies under a year. So what we've been doing at Ottawa Public Health is we've been asking all our staff, all our PHN, the lactation consultant that are helping with the baby helpline on the weekend, the nurses who are manning the Ottawa Public Health Information Center, everyone that when they talk to a mom that has a baby less than a year, they will mention the importance of, if they get frustrated with their baby crying, they're able to put the baby safely in the crib, to walk away and maybe call someone, family, friends, crisis line, something. Once they calm down, then they go back and see at the baby, check the baby. I think it's a message that needs to go out. These are parents that often, we have a few of those families with us right now, and these parents have no specific sign. They're not people mistreating their children day in, day out. They're good parents that just lose it for a second and it's enough. We've been also lucky. We had a discussion with Claudia Smith at the General Hospital, and she was suggesting to put CHEO has a fact sheet on crying baby. So she was suggesting to put that in the postpartum package that the clients get when they leave the General and the Civic. We thought it was a great idea. I thank her so much for this. It was wonderful. So that way, when our nurses at the general and the nurses in the civic are telling the parents before they go home, okay, you have that sheet inside your package. It's really important that you review it. So at least where these people are getting the same message. Our nurses who are PHN liaison at the Montfort and QCH are also doing the same. And I would like to encourage all of you who are working with new mothers to do the same thing, like definitely have that discussion with the parent. I think it's taking them by surprise. Before, they would have their mom, their aunt, their friend that would come over, but now it's COVID and we're not visiting, God knows where, and I'm public health, I know about that, but it's still extremely hard, I think, for new parents. So right now, this is what we're doing. The only thing I would like also to mention is that the Ottawa Public Health website has been updated. We had this mental health and substance use page during COVID, and there was no tab for postpartum parents. So we created a tab expressly for postpartum parents that has resources for them, because we had a tab for parents, but it was mostly for parents of school age, which have very, very different needs than the postpartum parents. Also, we updated, there's a new mental health resources, which is really services and phone numbers that parents can access. So that has been updated also to reflect the reality of the postpartum parent. And finally, I would like to ask you that if you have any clients that you think could use Ottawa Public Health services, home visiting services in prenatally, please refer them to us. We're lucky, we're at 50% capacity. So 50% of our staff is either in immunization or supporting the COVID response. So we still have 50%. We still have, out of that 50% staff, we probably have something like 18, 19 lactation consultants that we were able to keep. So we will make space if it's a partner that is referring those prenatal clients.
Thank you so much, Louise, for sharing this important information. And it's a good message because we have people in all areas of our region to reach out to your public health units. I know Louise is talking about Ottawa Public Health, but you know, it's a constantly evolving situation right now, and public health units are allocating their staff according to the local needs. But just if there's a concern, just tell families to call and reach out. And there's pathways that are organized to make sure that families in every community are getting the resources and support. So it does look different in every community, but every community is working on a response. And so, you know, we have people out of province as well joining this webinar. Just really look at your systems about who's available, and parents need to know like who to call, because you can't predict this, right? I think this is the thing that you don't know when.
You're right. It's constantly evolving. So the situation in each of the HBHC groups is also changing. So.
Yeah, but thank you so much. And I think there's going to be more to come related to this, but thanks for bringing this to our attention, and the call to action in terms of having the conversations with families. So during postnatal stay in the hospital and that early contact, you know, it's just bring it up as an issue, normalize it, and talk about those strategies if you do feel frustrated. So thanks, Louise.
Thank you.
Any questions for Louise before she pops off the webinar? Catherine, did any questions come in?
Well, I'll give time for people just to write them in if they do have any questions, but for the moment now, no, sorry.
Okay, so I'll switch.
Thank you.
We'll switch over here to continue with our presenters. So we're going back to Jen Faulkner and Sarah Murtha. So I think Sarah's delivering a baby right now or supporting a family. So Jen's taking it. Jen is a registered nurse and professional practice specialist at the maternal child program at Quinte Healthcare. And Sarah is a registered midwife through the Quinte Midwives. So Jen has been a registered nurse at Quinte Healthcare for 9 years and is part of the maternal child program since 2014, taking on the role of professional practice in 2019. So QHC is in their final months of working towards a best practice spotlight organization designation, and Jen is leading the person and family centered care guideline that has been implemented in the special care nursery and is in the progress on their pediatric unit as well. She has a passion for improving quality of care and supporting patients and their families through their experiences with healthcare. And she does have a few talking points from her colleague, Sarah Murtha. So I'll just give Sarah's bio and then we'll head over to Jen. Sarah has been a registered midwife with Quinte Midwives for the past 6 years. She works full-time in primary care model, serving women and their families in the Quinte and Northumberland area. She holds privileges out of both Northumberland Hill Hospital in Coburg and Quinte Healthcare in Belleville. She has recently taken on a new program that was approved by the Ministry of Health and Long-Term Care. This program allows her to support families outside of the typical midwifery model of care. And this includes newborns with no primary care providers and families that would benefit from added support. So Jen, please tell us about this.
I will do my very best to work through both of our sets of notes. So we're really grateful to have been asked to present what we're doing in the Quinte region to support families, presenting a bit of a different perspective from the hospital setting. So just to give a little bit of background for those who don't know, Quinte Healthcare is a 4-hospital system that serves a very large geographical region covering all of Hastings, Prince Edward County, as well as the southeast portion of Northumberland County. This region covers about 7,000 square kilometers, and we serve 165,000 people in our region. Our hospitals are located in Bancroft, Trenton, Picton, and Belleville, and all maternal child services are offered in Belleville. The maternal child program is an interprofessional team, including all labor and delivery staff, postpartum, special care nursery, and pediatrics, all contained within one unit. And we see about 1,400 deliveries a year. The maternal child program supports an outpatient Billy clinic for newborns needing any type of follow-up if they're at risk for jaundice. Pre-pandemic, this was supported by our pediatric group. So patients would be booked on discharge from the hospital, and they'd come to us and be seen by the on-call pediatrician. They would return to clinic or be admitted as needed. Otherwise, they'd be going home with follow-up with their family doctor. When the pandemic started back in March, we had to start looking at surge plans for our hospital if we had a large influx of patients. And one of the areas of concern was the emergency department and how they could support the needs of a large volume of people. So part of that surge plan was to incorporate our pediatricians into their model of care to support pediatric patients specifically within their department. The challenge that presented for our program was what we were going to do with the extra services we provide, like the Billy clinic specifically. They adapted their call schedule to accommodate our pediatrics unit, plus our labor and delivery unit, and special care nursery to ensure safety of all of our little babies in our hospital. So the Billy clinic became a big area of concern. In an attempt to cover that need, our nurse practitioner and our midwives took over the care of the Billy clinic patients. So they pulled together this huge team effort to accommodate the clinic, and it's allowed us to continue to offer the service. Beyond this clinic is our next big challenge, and this is where Sarah comes in. So our region's got a very large number of people without family doctors currently. And so it's been really hard to organize well newborn care. Public health has been limited in the support they can provide because of the pandemic. So their Healthy Babies, Healthy Children program has been prioritizing the need and providing phone visits and then in-person consults for the really high-risk people who need support. Walk-in clinics are the next available source for well newborn checks, which is a bit of a challenge. So Sarah's been doing great work to support that gap in care for us. So I will look to her notes. So Sarah's been providing care, postpartum care to families in the community since about December. And while working on the floor with newborns in the Billy Clinic at Quinte Healthcare, the amount of families being discharged without a primary care provider was becoming consistently an issue. We have called these babies our orphan newborns, and we do have a great group of family doctors in the region who are willing to take on some of these patients, but that is limited overall, and the need was greater than what they could accommodate. The program that Sarah is running connects families with her and one other midwife who are in need of follow-up care and who generally don't have a family doctor, or they require a closer follow-up due to risk factors. Some families are new to the area. Some have a doctor back wherever they moved here from. And often there's many people from the GTA, it looks like. And a lot of them were unwilling to travel back to Toronto because of the ongoing pandemic. The program receives referrals from the postpartum nurse on our unit or from the nurse practitioner providing well newborn care on our unit and the pediatricians if they identify a need that the family would benefit from a close follow-up. The midwives try to save space and take on families from the marginalized populations within the community, anybody lacking transportation or limited resources. The visits include well newborn exams with weight checks, breastfeeding help, etc. They take place in the home and in the midwifery clinic in Belleville. Visits are tailored to what the need is. For example, one of the pediatricians referred twins born at 34 weeks. There was no family doctor on discharge and they had declined healthy babies, healthy children. There was no transportation, there was limited family support, and over the next 6 weeks, Sarah is going to be following this family to ensure a smooth transition from hospital to home. The weight checks are going to occur more frequently or as needed in the first couple of weeks at home. And then as that progresses, she'll start seeing them in the clinic if she's able. For midwives, it's within their scope of practice to care for families postpartum up to 6 weeks. So that typically has been the time frame for this care model. And at discharge, they're referring them back to Healthy Babies, Healthy Children and public health for vaccination. And they'll refer them to our pediatric clinic if there's anything ongoing in terms of medical care that's needed. Sarah is hoping that the program will fill the gap for 6 weeks and at least get families off to a solid start. And we are hoping it can continue beyond this trial period because it's been really exceptional service for our community. That's it.
Thank you so much. And again, you're providing the hospital perspective, which was so important. And again, really looking at all of your resources, the providers that are currently in your system, and you've identified before a gap of family physicians in your particular community. That's not unique to the Quinte area. I mean, other communities are having that very same challenge, but it's just so impressive that you're looking at how do you realign providers working in different departments and how do you still maintain that level of service or increase in the case of the pandemic and just all those restrictions. So all the surge planning that you talked about, the adaptations of call schedules, like everyone had to be so flexible, right? And so accommodating and just kind of figuring this out as you went forward. The midwifery program, that's an innovative approach, right? An untapped resource in terms of someone who's highly skilled, who knows newborns, who knows the signs of jaundice, how to support infant feeding, how to enhance parental confidence, like, such an ideal person within our healthcare system to be able to pick up the gap. So it sounds like Sarah and her colleague are really doing an amazing job. And I love that situation that you had with those 34-week twins in terms of like what would have happened if there was no program like this, how many weeks would have gone by before they saw someone and what would have been the situation. So that's such a great story.
Thank you.
It'll be a success story. Yeah. So what questions do we have for Jen and Sarah in her absence.
So I'll invite people to put them into the question and answer box right now. We did have one outstanding question that was answered through the Q&A. So I thank you, Jody, for providing the answer, but I will read it out as some of you might just be on the phone and not being able to hear or see the comments. So we had a question for Jody that where was the wait service offered, and could anyone access it, or was it only specific to a catchment area? So Jody was nice enough to put the answer into the Q&A. So they're offered at the Centertown Community Health Center, and has given us the address, so located at 420 Cooper Street. And their service is not only for catchment specific, it is open to anyone within the community, and you can book the appointment by calling their medical reception, and has given the participants the number, so 613-233-4697. So I don't see any other questions for Jennifer or even for Louise up there in the moment, but again, don't be shy, and you can use any of the questions and answer as well.
I was just wondering if there's someone from Montfort who's on the call, if you could raise their hand. There's a question about a similar program that's offered here in Ottawa in terms of midwifery follow-up in the postnatal period. So I'm just looking to see who some of our attendees are. If not, Catherine, are you able to answer
I
that
can
question?
provide a bit of an update as well. We have one of the lead project from the Montfort for that specific program as Laurence Turba, being a part of our midwifery community of practice. So she was able to provide us a bit of an update at our last meeting that this program, so this...
Oh, I think she's raising her hand, so I'm going to allow you to talk, Laurence.
Yes.
Go ahead and see if you can...
I wasn't sure if it was you because you only had put Laurence, so sorry for putting you on the spot, but go ahead.
Hello, hi, I'm Laurence Turba, yeah, and so I am one of the midwives since the beginning of the Montfort postpartum home health care program, yeah. Do you have any specific questions, or do you want that I just explain what we do?
The question was, is the program still being offered through the pandemic?
Oh yeah, and yeah, we double kind of the numbers. So yeah, by chance we start before the pandemic, so we were a little more organized when everything starts with the pandemic. And yeah, so the client will be discharged early, like they are not staying as the routine usually stay. So for vaginal delivery, they will be discharged between we say like an average of 10 hours after the birth and after 24 hours after C-section. And so we see them the day after at home and for a week. So the first week of the program. And what's happened during the pandemic, we had the same issue with a family doctor, because usually, so our families after the first week are going back to their own family doctor. So we have family with no family doctor, and we have families that the family doctor will not see them for weeks. And that's still happening. Like we are still dealing with a lot of families that have no appointments after the first week, and for like sometimes until the first month of the baby. So we are still struggling with the between, because the program, we get the funding for 1 week, but especially with breastfeeding issue, sometimes it's good for families that they could wait the baby. And so we are still a little struggling with this. What we did is that we order more scales. So now, since the pandemic, what we were doing is that we will let a scale at the house of the client, and we will have a phone talk. And we teach them how to wake the baby at home. And as soon as we know that, okay, the baby is back on track and the breastfeeding issue, everything is better, we will just pick up and disinfect the scale. So that's kind of what we are doing. We are offering all the jaundice assessment with a transcutaneous bilirubinometer, at home to avoid family to have to go back to the hospital for this. We had a specific budget for COVID, so we were able to increase. We are actually 2 part-time midwives working on the program, and so between April and of September, we were up to 4 midwives, and a nurse from the CFN was helping us too. So, but in September we are back to 2 part-time midwives for the program. But we still have the demand from the family.
Yeah, so you're mentioning that could reduce a hospital stay because you had the early follow-up care by a midwife. So my question to Jen, with the model with Sarah and her colleague with Quinty, are you able to reduce length of stay, or it's regular length of stay and then just that safety net after for follow-up in your model?
So for the patients that are unattached or the orphan newborns, the length of stay has stayed the same. So that piece of our model of care hasn't changed.
Okay, so that stayed the same, but more for Laurence, you were saying that you've been able to reduce length of stay because you have that follow-up with the model offered there.
Yeah, it was the goal of the program since the beginning. So the family have the choice, the options between staying the regular stay and going back to their family doctor, or having the early discharge, and we come to see them at home.
You know, it's so interesting because there's it's split, you know. We've worked very closely with our family advisory committee, and this came up so often. There was initially a fear. People didn't want to go to the hospital because, you know, everyone's like, stay away, you know. But then we had to have this message saying the hospital is a safe place to get care. So we really had to do a lot of work to help families. Yes, if you need care, if you have a concern when you're pregnant, or, you know, come deliver your baby at our hospitals, they're safe. The teams are prepared to care for you, all the safety measures in place. And then we were hearing families on the unit, I don't want to go home. Everything was so well, they were so well taken care of. There was a lot of attention, you know, so then it became really cozy. So people, you know, wanted to stay a little bit longer to make sure everything was going okay, you know. So it was kind of a little bit comical in terms of the tensions, people's concerns, and then, you know, just receiving really awesome care. Some families still wanted to get home as soon as possible, but it's, you know, that responsibility to make sure that there's a good follow-up plan in place. So it's certainly been very, very interesting. We've just started the conversation today with our amazing panelists. I want to thank Jody and Jennifer and Louise and Laurence, a last minute addition to our discussion for today. All of your questions and answers. We do have part 2 next week, which is largely going to be focusing on Monarch Maternal Newborn Center. So that's next week, February 17th, 5 to 6 p.m. I think most of you have registered for both of the events. Our specific presenters are Dr. David Miller, who's the lead family physician and executive director at Monarch. And we have Dr. Daisy Moores, who is a family physician and head of the Division of Maternal Newborn Care at the Ottawa Hospital. She was also co-lead for the Postnatal Taskforce. And then Tara Parsons is a registered nurse, IBCLC, at Monarch. And we'll have Dr. Ward come and speak a little bit more about what they're seeing at CHEO in terms of the injury, head injuries in infants. So I want to thank everybody for your time and your attention today. I know it's tough at the end of the day. Special thanks again to our presenters and to my colleagues for all the support behind the scenes for this webinar. And we'll get the recording to you as soon as possible and upload a few resources to our website. So thank you very much, everybody, and have a great evening.